If you are new to my channel and want to educate yourself more about herpes viruses, please like my videos and subscribe to my channel. Make sure to ring on the notification bell so that you'll be the first to watch my uploaded videos every day. Let's put an end to the herpes virus.
Anti-herpes drugs pharmacology. Acyclovir. Operation of action. Acyclovir is actually activated as follows. Virus-specific enzymes transform acyclovir to acyclovir monophosphate. Host cell kinases transform acyclovir monophosphate to diphosphate and after that to the triphosphate. Since virus-specific enzymes are actually needed, acyclovir is actually activated only in contaminated cells. Some virus strains lack thymidine kinase and thus reveal resistance to acyclovir. In these situations, cross-resistance to famciclovir, ganciclovir, as well as valacyclovir likewise happens. Acyclovir triphosphate inhibits viral DNA formation through the following two mechanisms. It serves as a competitive substrate for DNA polymerase. It irreversibly binds to the viral DNA as well as triggers chain termination. Medical uses. Acyclovir is actually utilized in the treatment of HSV-1, HSV-2, as well as VZV infections, although it reveals higher potency in the treatment of HSV compared to VZV. The order of level of sensitivity is actually HSV-1, HSV-2, VZV equals EBV. Accordingly, greater doses are actually needed when provided for VZV. There are actually three formulas of acyclovir offered: oral, intravenous, as well as topical. Oral acyclovir is actually unaffected by food, however bioavailability is actually reduced to 20%. Topical acyclovir can easily be useful in skin lesions and has the advantage of no systemic responses. In HSV encephalitis, neonatal HSV infection, or even various other HSV as well as or even VZV infections in immunocompromised patients, intravenous acyclovir is actually a drug of selection. Unfavorable effects: toxicity. Since the drug is actually activated just in contaminated cells, acyclovir is generally properly tolerated. Nevertheless, migraine as well as intestinal symptoms, nausea or vomiting as well as diarrhea, have actually been noted. Sometimes, intravenous administration can easily result in severe renal toxicity, which is actually dose-dependent, as well as some neurological negative effects, like seizures as well as delirium. These unfavorable effects could be prevented through appropriate hydration of the client during the course of treatment. Drug interactions: due to the possibility of renal toxicity, concurrent use of acyclovir along with various other nephrotoxic agents needs to be prevented. Cimetidine as well as probenecid boost exposure to acyclovir with reduced clearance of the drug. In patients getting concomitant zidovudine, lethargy as well as somnolence are possible effects. Contraindications: using acyclovir is actually contraindicated in those along with previous allergies to acyclovir or even penciclovir. Kidney illness as well as enormous volume loss are actually relative contraindications for acyclovir treatment due to possible kidney damage. Valacyclovir. Operation of action. Valacyclovir is actually metabolized through first-pass metabolic process into acyclovir. Oral valacyclovir has actually far better bioavailability compared to oral acyclovir. Medical uses. Genital herpes, herpes labialis, as well as VZV infections. Valacyclovir is actually offered just as an oral formula. Unfavorable effects: toxicity. Valacyclovir has actually almost the exact very same metabolic process as acyclovir, creating it a safe medication. In higher doses, symptoms like confusion, seizures, as well as hallucinations have actually been stated, however are unusual. Gastrointestinal intolerance, thrombotic thrombocytopenic purpura, as well as hemolytic uremic disorder are actually possible, however incredibly rare. Contraindications: previous allergies to acyclovir or even penciclovir. Famciclovir. Operation of action. Famciclovir is actually a prodrug that's metabolized to penciclovir with first-pass metabolic process, deacetylation as well as oxidation. Mnemonics. It is actually phosphorylated through virus-specific thymidine kinase, creating this drug very specific. Just like acyclovir, it is actually a competitive inhibitor of DNA polymerase, however it doesn't trigger chain termination. Penciclovir triphosphate doesn't have actually the affinity to a DNA polymerase that the acyclovir triphosphate has, however it gets to a greater concentration in the cells. Medical uses: genital herpes, herpes labialis, as well as herpes zoster. Just offered as an oral formula. Unfavorable effects: toxicity, migraines as well as intestinal symptoms. Drug interactions. Famciclovir ought to not be provided 24 hours prior to or even 2 weeks after VZV immunization. Contraindications: hypersensitivity.
Thank you for watching. And please subscribe to my channel for my upcoming herpes treatment videos.